just what we did. We mixed it with water, and this is what happens later. Okay, those of you who like to work with tools, dentist tools are kind of similar to like construction tools or anything that you would make, only they're really, really small. So like if you've used a power drill, like to drill a hole in the wall, you know, they're big. And the drill bits are like about that long. This is a dentist drill. It's really small. And I'm not going to pass this around because this costs a couple $1,000, you know, just for one of these. Dental tools are small, but they're expensive because they have to make them so that they can go through an autoclave and get sterilized. And I've got something, oh yeah. Here's a couple of drill bits that we put them in here so that there's a little bit on the end. And I'll pass these around. These are just really tiny. And you can look at them and see how small they are.
Oh boy,
they're really small.
Lose it?
Yeah, they're really tiny. But they have to be small. Okay. Okay. And is anyone using an electric sander with those sanding discs that are like about that big if you're going to sand down some furniture or something like that? Well, this sander that we use, I brought one of these. This is a sander that we use when we polish someone's teeth or when we put a filling on there. Like if somebody broke their tooth off and we put some tooth-colored filling material on there to fix it and make it look like a regular tooth, we use one of those little sanders to kind of smooth it out. And the one I'm passing around is the larger size. We have two sizes. That's the larger size, and it's small. It's really small. Okay, who's changed a tire before? All right. When you change a tire, you use a torque wrench so that you don't tighten it so tight that you can't get it undone, or you won't get it too loose so the tire will fall off. Well, in dentistry, we use torque wrenches too, really tiny ones. Like if you have a little implant or something in your jaw, and you're going to make an artificial tooth that screws down into that implant, you use a torque wrench. Because if you do it too hard, you could break the bone in your jaw, and if you do it not hard enough, it could fall out. So that's why we use a torque wrench. One of these torque wrenches costs about $700. It's tiny.
Beauty wrenches,
Okay, and this is my screwdriver right here. That's a regular screwdriver, and I brought it with me right here. It's really small. And we have to sometimes we'll have to screw like a little metal post in someone's tooth, and we use this. And it has little grippy things around here to help you so that you don't drop it in someone's mouth. So that's a screwdriver.
you do wrenches a lot.
Some, not as much as we used to because of implants. Okay, and we get to extract teeth, and I actually brought some of my tools. I'm going to show you how to extract a tooth, and maybe someone will help me. Who's the other one that's interested in dentistry over here? Is that
Alana?
You? Oh, is that you? You want to come up for a second? All the instruments are in these packs because we put them in these packs and then we run them through the autoclave to sterilize them. So when we're going to use them, we just break them open. And this is a little forceps that we use to pull teeth. And this one happens to be an upper left first molar extractor, because each tooth has its own one that they do that fits on it. And these are elevators. They also look kind of like screwdrivers too. And so when you pull a tooth, and when you're talking about left side, you're talking about your patient's left side, not left side as you look at it, but your patient's left side. So we're going to extract this tooth right here. It's the upper left first molar. And the first thing we're going to do is we're going to put this in between the teeth, and we're going to loosen it. We just kind of loosen it up a little bit. So
Are they going to what? Whiten them?
that one right there, and just put it in between.
You can.
And kind of loosen it up.
You
Okay.
can, but the
And then you
orthodontist
take
doesn't do that,
this,
I don't think.
and you put it around the tooth like that.
I
else want to pull a tooth?
This is all safe.
Pardon me, you want to try? Okay.
I would imagine.
Stop
because
messing
that's
with
what
the
they put in your mouth.
Okay.
Your impression.
So when you pull a tooth, the first thing you do with this is you loosen the tooth up with the side thing. Okay? Yeah.
Yeah, okay.
Yeah. And you take it
I
in.
never wiped it.
Good job. Okay, yay, okay. So we pull a lot of teeth. Okay. And we do a lot of cosmetic stuff too. Like this lady that came in, she didn't like that big gap in front of her teeth, in the front. So we took some tooth-colored filling material and we just kind of filled in the space. And we matched the color of the filling material. We have lots of different colors. To the color of her teeth, yeah, we can match it. And then we use the little sandpaper thing that's going around and we can smooth it off so it looks just like a regular tooth. It looks like she never had the gap. And sometimes, with this one, this is Michelle.
Oh,
She
well, I
is
guess it
she's a
could.
teacher at Bellevue University, and she didn't like the gap in her front teeth. So the way we fixed this one is with clear braces, like Invisalign. Although we use Clear Correct, it's a different kind. But we did some braces on her and filled up the gap, and it was fun. Now, there's a lot of different types of dentist jobs. You know, you think of, you just go to the dentist and there's the dentist, but you can, what I do is I work in private practice, which means that I'm a business person as well as a dentist. I own my own practice, and so I have to do all the hiring and firing, I pay all the bills and do all that stuff too, besides the dental work. And it's nice, it's very rewarding. You have a lot of control over your career and what direction you want to take. You can buy the tools that you want to buy. You can, just kind of do what you want. You can also work in public health. Sometimes when you finish dental school, most people have a lot of school debt. And if you work in public health, they will help you pay off your school debt. And public health clinic would be like One World Dental Clinic here in Omaha, where they do dental work for reduced fees. You could work on an Indian reservation. You could go to Alaska and work out in the wilds, and that way you get paid by the government, and they help you pay off your student loan. The same with the military; they will help you pay off your student loans as well. Go in the yard. Military dentistry is a really good opportunity. I know probably a lot of you are from military families, at least some of you, and you've lived different places. You get to do that as a military dentist, and when you're in the military, you're not on the front lines of any conflicts or anything like that. You're just fixing teeth. They do some dental work that you do in the military is in like portable dental clinics. They'll set up a tent like out in the middle of nowhere, and they have like portable equipment that you can use. Have you done that? It's kind of fun. I haven't done that, but I've done like we did what they call Mission University one year at Pavilion South High School, and they just set up portable dental equipment, and whoever showed up, they could get their work done for free all day long. So that was fun, and it was kind of the same equipment that you use in the military, just kind of portable setup. You could be an employee dentist, like do you know that the dental office near Walmart that's called Pavilion Dental Care? It's right next to the bank, and it's right there anyway, if you notice it. They're owned by Heartland Dental, and Heartland Dental has a bunch of dental offices in Omaha, and they hire dentists to work for them. So if you don't want to have to hire and fire people and pay the bills and do all that stuff, you can work as an employee, and you just go to work and they pay you a salary. So it's pretty easy. So a place like Heartland Dental is where they would hire. You don't have as much control over like what hours you work or what materials you get to use, but it's less stress though, if you like that. Sometimes dentists will injure an arm or hand or something like that, and they can't practice dentistry anymore, so they'll go to work for an insurance company. So if you like, work in a different sector than that. Okay.